When it comes to autism spectrum conditions, the two hallmark features are difficulties with social and communication skills, and then also restricted and repetitive behaviours and interests. There's no biological test for autism, so it's down to observation across environments, and we're seeing a person present with these challenges, and different people will require different levels of support for these challenges. The signs will present quite early in childhood, and then the kinds of signs may vary across the lifespan as one gets older. It may start out with difficulties with developing language or an overly formal style of language. Also difficulties maintaining a conversation, so back and forth, or if they are maintaining a conversation, it could be quite one-sided about their own personal demands or interests. You might see rigidity around things needing to be done in a particular way, and some distress if that routine's changed in any way, or difficulties knowing what to do if a situation isn't highly structured, such as play, which is a very unstructured activity. In the classroom, we might see people having trouble with knowing what sort of things are appropriate to say, unintentionally appearing rude when they're just pointing out, that there was an injustice, or that the teacher's misspelled a word. We could see an intense interest in a topic that can be a real source of talent for the individual, but then also can impose on themselves or impose on the family, having to accommodate so that person can pursue that interest. For teachers, the first thing would be to note exactly what you're observing that you're finding unusual or interesting, and report that behaviour back to the parent. So give the observer what you're observing, rather than just describing, there was something that was unusual. So the parent really needs to understand what's going on. Then I would say the parent should raise their concerns with their GP. If the GP thinks there's sufficient evidence to warrant a further assessment, they'll refer you to a developmental paediatrician for a child, or for an adult psychiatrist, and then that'll get the ball rolling with the assessment to rule out any medical explanations and see whether autism spectrum is the best explanation for what's going on. Well, I'm really excited, having been to CPA at Allambie Heights a couple of times. The resources there are incredible. You've got the swimming pool, the gym, you've got a range of multidisciplinary allied health professionals. And so I think Diverse Minds is really eager to collaborate in that way because of all the resources, and because CPA has been leading the way in the field of disabilities and with their work in cerebral palsy for such a long time. So yeah, we're really excited to collaborate and strengthen those bonds and ensure that we're providing a high level of service for the community.